This is not a solution. This is not an appropriate solution.
On Monday, the province announced a new employment program that would bring nursing students into hospitals to help address the staffing shortages. But some nurses that we spoke to said this will cause more harm than good.
We are announcing a new role that will support care within our hospitals, a role that is new to Manitoba, but which has been in place in a number of other provinces across Canada for many years.
Third and fourth year nursing students will soon join inpatient care teams in hospitals in hopes of helping ease the enormous strain on nurses. But one staffing nurse from St. Boniface Hospital, who has asked to remain anonymous due to fears of repercussions, says this is a potentially fatal decision.
As a nurse, we have to register with the college and we have to pay for insurance, and everyone's just concerned who is going to be insuring these students. Like, inevitably some mistakes are going to happen, and who's going to be covering?
The nurse we spoke to says bringing in students will ultimately affect patient care, as nurses will be focused on ensuring the students aren't making mistakes.
Nurses aren't, going to want to have to watch someone on their entire shift. And if I had a nursing student that was kind of working under me and I was responsible for them, I would want to be watching everything that they're doing. And if I'm watching everything that they're doing, I might as well just do it myself.
We spoke with another nurse who told City News that bringing in students will help the staffing shortage and will help bridge the transition from being a student to a working nurse, making them more confident in the field. The Manitoba Nurses Union says its members are simply worried. Quote, workloads for nurses currently in the system are already heavy. There are also concerns about liability, which we have understood are being looked into by the colleges. That said, we at MNU look forward to providing insight into this program and thinking critically about proper rollout prior to execution. Shared Health says the program will start with just over 60 nursing students from across the province to be placed in medicine, surgery, and mental health units, but down the road could have the potential to include closer to 500.
We're going to see how it goes, but we are hoping before the end of the year we'll be introducing these students into the clinical placements, and then we'll evaluate regularly and gradually build up over time.
Saragusa says the position pays around $27 an hour, offering evening, day, and weekend shifts, but says the positions won't fill current staff shortages in the short term. The nurse we spoke to says if this won't help in the short term, then why put an already strained system at more risk?
These nursing students have a significant amount of responsibility to alleviate the RNs. I don't feel like it's safe for our patients.
In Winnipeg, Alex, Karpa City News.